Blackstar 1 is en route to the upper pad with a 5-minute ETA with 50-year-old female patient. Patient presented today to Mercy Hospital with a sudden onset of generalized weakness and flu-like symptoms, nausea, vomiting, and diaphoresis. Patient has a past medical history of diabetes, hypertension, and is a pack-per-day smoker times 20 years. Current vital signs on this patient.
When you or a family member is in an emergency medical crisis, you depend on healthcare professionals to make quick decisions and communicate effectively.
This is where seconds make a difference in someone living and not living.
Good. This is Mrs. Bell. She's 50 years old, has a history of smoking, 25 years.
At SiMCentral, our future healthcare professionals have access to the highest standard in healthcare simulation education.
We know now that teamwork can save lives, and with simulation training, we can put teamwork into effect.
Well, it gives us some hands-on, most importantly the feedback, that we can walk through the steps and revisit that and see if there's anything that we can improve.
Everybody knows what they have to do, when they have to do it, and very, very quickly.
By combining resources, Amarillo College, West Texas A&M University, and Texas Tech University Health Sciences Center team up to create SiMCentral. Students from all three institutions participate together in interprofessional simulation exercises. These experiences improve proficiency, which ultimately enhance patient safety by utilizing advanced technology mannequins in a controlled and safe environment. The exercises mimic real-life situations and experiences.
So that I can actually pronounce my symptoms through the mouth of the mannequin to the young doctors and nurses and pharmacists who are learning. They hear so I can say, "My chest hurts."
What's going on?
And then I have a headphone on, so I can respond to what they say to me, and we carry on a conversation.
And that doesn't mean that everybody who says I'm tired who comes to your clinic, that you're going to put them through the full cardiac workup. No.
Students here are briefed prior to the simulation about the female patient they'll be caring for during the training exercise. They're learning that the symptoms of a heart attack can appear different in men and women.
You have the classic symptoms of, there's an elephant on my chest and my arm hurts, and a lot of times with women that's just not how a heart attack happens, and so it's important for us as medical professionals to be able to recognize that and look through what may not be classic symptoms and still see what's actually going on.
Women tend not to maybe have as much chest pain or have any chest pain at all, and so it's really important for young doctor, old doctor, anybody to recognize this and not assume, well, this really isn't anything serious, when it really could be a heart attack.
It's something we've observed, and now we need to be attentive to it so that we don't miss it in women.
For this simulation scenario, medical, pharmacy, nursing respiratory therapy, and paramedic students work together to prepare for real-life medical emergencies. They execute medical procedures and practice teamwork. The exercise better prepares the students for real-life medical situations.
Some of the specific things are passing a patient off from the EMT when they receive them to the ER room where the nurses can receive them, moving them over to the bed, the 12-lead EKG placement, and some of the labs that are needed, as with our chest pain patient, getting the H&H and the cardiac and all of those that we need to be able to see what's going wrong.
In these types of scenarios, we can also keep in mind, the importance of other team members and the collaboration between the team members to maximize the patient care.
And it's a safe environment because they can make mistakes, and they might do something that I could say that could kill the patient. I can make the vital signs go to zero. And say, you guys, that was a serious mistake. You don't want to ever let that happen.
You can read about it in a book, but it's not the same as actually having to do these things and remember all the details about it that you may not realize when you're just reading it in a book. So it's a good experience.
We know that knowledge doesn't decay as rapidly when they've got this hands-on kind of learning experience coupled with the didactic, which is the reading and the lectures. It's a better way to learn.
But it's a safe environment where you can learn there rather than, God forbid, you ever have that happen to you as a mistake for the first time on a live patient.
When everyone on the healthcare team works together, they achieve the best results possible. Just like in sports, every team member is essential for success.
You go over the play many, many, many times before you actually run it in a game, so you can run it as perfectly as possible.
I bet every patient would love that we have this training, and I bet some would even request that we have it more, because the more you practice, the better it helps us.
In the interprofessional exercises, medical, pharmacy, nursing, respiratory therapy, and paramedic students practice together to gain essential clinical experience and critical thinking skills. This simulated life saved today could be a real life saved tomorrow.